Matt, what is asthma? How does it affect the body and how do you manage it?
Well, Scott, we joined Dr. Christy Isaac Rapp, Assistant Professor of Clinical Pharmacy with Xavier University, to explain.
Asthma is really a disorder in your lungs. So think of it as a hose pipe. When you have a hose pipe and there's water going through it, if you have a kink in the hose pipe, the water can't go through anymore. So think of that as your airways. If you have a kink in your lungs, the air can't go through. So that's when you start feeling those symptoms, shortness of breath and tightness. And so that's how we sort of want you to think of asthma in that way, when you can't breathe. First and foremost, asthma is a disorder that can be controlled. You just need to be educated and be aware of the signs and the symptoms, the triggers of asthma, and also know what to do if the triggers and the symptoms occur. How do you treat asthma? Asthma medications are a very important part in treating asthma, as well as some things that you can do to avoid things that may make your asthma worse. So when we're talking about asthma medications, we have two types. There's a rescue type of medication when the asthma patient is feeling symptoms. They feel it right then and there. And then there's something we call a controller medication. And those medicines, the asthmatic should take every day to help prevent those symptoms. This is a metered dose inhaler. Proper technique for a metered dose inhaler would, of course, include pressing the actuator or the top of the device and breathing in at the same time. This is the most common problems that we have with our children. After the patient presses the top of the device, they're going to breathe in slowly and hold their breath for 10 seconds. So they count to 10, and once they hold their breath for 10 seconds, then they can exhale slowly. This is a spacer or a valved holding chamber. This allows the patient who is not coordinated enough to depress that actuator and breathe in at the same time. It's going to help the medication go further in the lungs. So this device is excellent to have. This is a nebulizer here, and what happens is there's medication that comes as a liquid, and they come in little vials, and the medication goes in here, and it also hooks up to a compressor. And when you flip it on, it makes the liquid a mist, and the child is able to breathe in the mist, and it helps with their asthma. Keeping the asthma medications clean is very important, because you want to make sure that your medication is delivered to the lungs as it should be. If it's not getting to the lungs, it's not going to really help you with your asthma. So with your inhalers, you want to make sure it's clean and it's not clogged all up where the medication can't get out. With your spacers, again, you want to make sure that you keep them clean and wash if appropriate, as well as the nebulizers. Triggers are really things that make your asthma worse. So what would make your asthma worse? Common triggers would include pollen in the air, dust. Some triggers are animals such as cats and dogs, grass in the springtime, pollen on trees and flowers. Cigarette smoke could be a trigger. Perfumes, even emotions sometimes. When someone gets very upset or even very happy, that may trigger their asthma.
Up next, what environmental triggers can affect asthma and what can you do about it? Plus, we look at asthma-friendly schools and how DHH is helping to educate school personnel and students on asthma.
But before a brief break, we have a question for you.
What percentage of adults in Louisiana have been diagnosed with asthma? A, 4%, B, 12%, or C, 18%?
We'll be back with an answer in a moment.